Dr. Tom Roselle live right now, 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We are here at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. My guest, Dr. Harlan Browning. We are talking about neurological stress and how it affects the body and causes all kinds of symptoms. But before we get back to that, I want to answer a waiting call very quickly. Shirley, thank you for calling and thank you for waiting. How can I help you?
Yes, good afternoon to both of you. Yes, my question, I make them as brief as I can. First, I have very bad glaucoma. I think it's the close-angle glaucoma.
Uh-huh.
And I, at this time, using COSOP, and I believe that is not really lowering the pressure. Plus, I have this bleep or something that's in the eye. I had been told about a herb, Xanthine, if I'm pronouncing it Zeaxanthin, herb that was good for lowering the eye pressure in the eye. And I want your expertise about that. And also the second question is, I have very bad arthritis in both knees and legs, a lot of soreness and stiffness.
Okay. Well, let's take the glaucoma first and talk about the pressure that's there. Other than we'll kind of keep the topic away from medical marijuana, but THC does reduce the pressure. Now, having said that, and tongue-in-cheek, there are many different things that will reduce the pressure. Mixed carotenoid supplements are used, and you can get them in combinations. Many of the health food stores have them as well, including beta-carotene, lutein, zeaxanthins. They all work well. Luteins and zeaxanthin are carotenoids, and what they do is they help protect the retina and the lens of the eye, and together with the addition of some vitamin C and some vitamin E, they will stop the eye from further free radical damage. Other things that you would add to that is the utilization of blueberries, and they have high levels of several of these substances, including the luteins and zeaxanthins, and then ginkgo biloba, which increases the circulatory pathways to the eye, increases blood flow, if you will. So all of those things are useful, and actually there's a huge list of different things that you can do, but you want to eat as many green vegetables as you possibly can, or colorful vegetables. You want to keep anything that causes free radical damage down in your body. Now, having said that, let's talk about the structural piece. The buildup of pressure in the eye has to do with a lot of different things, and one of them is the position of the cranial bones, the skull bones, and also the temporomandibular joint. The TMJ, or your jaw, your lower jaw joint, as it opens and closes, metaphorically is said to be the pump handle of the rest of the head. And if the skull bones aren't moving, the spinal fluid can't move up and down the spine normally, and then subsequently what happens is you end up creating pressure. We've had tremendous success with not only dietary changes, but the utilization of manual manipulation, craniosacral work, and acupuncture to resolve or at least dramatically control the pressure of glaucoma. So, having said that to you, I'm going to answer that. We'll probably get into arthritis question later, but I can only have time for the one right now. So, eat a lot of vegetables and make sure that you're drinking plenty of water. Don't eat anything or put anything in your body that has the potential to cause free radical damage within the system. And if we can be helpful to you, please give us a call. You can reach us on the web at rosellecare.com, or simply call us at 703-698-7117, and one of my doctors will get back to you. Shirley, thank you for your phone call. I appreciate it. That's one of the things that we see all the time, and I wish we had more time to get into that. Actually, that whole cranial mechanism has to do with what we're talking about today.
Sure.
It has to do with the stress patterns that are structural, chemical, emotional pathways.
Yeah, I would add one other piece to that. Essential fats, I think, are extremely important when you're talking about any eye situations, glaucoma, or anything, because they make up the membranes that are so essential for us to see with.
It's important that nothing happens just because. That there's a course of events that takes place. The spinal fluid moves because of the respiratory pattern of breathing in and out. The bones of your skull have the ability microscopically to expand and contract, and underneath that there's a big sheath. It's like a piece of saran wrap, and that combination of the saran wrap pulling the head back and protecting and acting as the lining of a buffer causes a balance, and when that balance is disturbed, you have an electrical system that doesn't fire the way we're supposed to. Anyway, we can talk about that probably for the rest of the program, but we don't have the time, and we're coming up to a break for news and some information. But Dr. Harlan Browning is my guest, and we're talking about neurological stress. Don't go away. When we come back, we're going to talk about what happens actually and how the body begins to break down under stress, what the symptoms are, how you end up in pain. Don't go away. We've got some real super information for you. And if you'd like to register for the class, 703-698-7117. You're listening to Dr. Tom Rosell Live. We're here at 888-630-9625. That's 888-630-WMAL. My guest, Dr. Harlan Browning. We're talking about stress patterns, neurological stress, and how it affects so many different things. We're going to get into how do you know if you're under stress? How do you know if structurally, chemically, emotionally that you've had stress patterns? We're going to talk about that. We're going to put the pieces together. But before we do that, Linda, how can I help you? You've been holding very patiently.
Oh, yes, thank you. I had this tested back in December. I'm dealing with a Lyme doctor. Not even sure that I have Lyme for sure or not, but one of their lab tests was something called C4A, measuring the toxins in your blood, which at that time was quite high, the 5,000 range, which is supposed to be between 300 and 1,800. We just retested a few weeks ago, and now it's 7,000. Now, this test does not specify what toxins are in your system, and so now they want me to try B12 injections. And I want to get your thoughts about that, and sublingual B12, and if that'll be a good start for this detoxification.
There's a lot of things I need to know about you before I could even get into that. But let's start with some basics. First of all, C4A is a protein, and it's that's found in the human genome, and it's one that's being used specifically. It helps in the diagnosis of lupus and also type 1 diabetes. However, when it comes to other autoimmune markers, it is another marker. It's nothing that's specific. And so you can't make a diagnosis just based on what the C4A is doing. It tells you that there's other things. Matter of fact, with what we're talking about today with neurological stress patterns, you'll see shifts in the C4A marker simply because of the amount of inflammatory response that is occurring in the body, and the immune system is becoming challenged, if you will. Okay. So, I mean, there's a lot of other things that you can get into, C4As, C4Bs, and so forth. But that's what C4A is. Now, having said that, B12 is one of those things that if you have any inflammatory reaction in the body, you're going to have a B12 problem, B12 deficiency. Some of the easy things is just simply looking at a red blood cell, and you're going to look at the size of the red blood cell. It's called MCV level, and it needs to be textbook between 88 and 92. The range goes all the way up to 100, but it's either too small or too big at that level if it goes outside of that. If you're going to take B12, you want to use the type of B12 that is going to decrease the inflammatory pathway. The only one that does that is the hydroxy form of B12. There are three types. There's cyanocobalamin, there is methylcobalamin, and then there is hydroxycobalamin. And you want to take the hydroxy form. Perk Laboratories produces a very nice product. It's called activated B12, and you would take that in conjunction with a lot of folic acid. So how much? You would start out with taking something in the neighborhood of about 4,000 units of B12 3 to 4 times a day sublingually with greater amounts of folic acid as well. And what you're going to observe is the liquefaction rate of this activated B12 underneath your tongue. Now, unfortunately, the only place you're going to get that is from a physician who uses it, because Perk won't sell it to anybody other than a doctor. But to tell you exactly what to do and how to decrease your inflammatory pathways, I need to see all of your blood work. I need to know a history of injury. I need to know what your diet is doing. I need to know what other things are going on. I'm not hedging you. I'm telling you that I need more information.
Correct. Thank you. And I am coming in to see someone next month in April, but I want to get a head start on this. Okay. So what you do is you start cleaning up your diet. Start drinking a lot of water if you're not. I do that.
Okay. And you want to add maybe just a pinch of sea salt to your water. and you want to make sure that you're getting 7 to 8 servings of fresh vegetables a day. Do not fry them. Make sure that they're either steamed, or they can be, some of them can be raw, or you pressure cook them, or things of that nature. Stir fry them. You want to keep the type of proteins in your body to fish and chicken and things that haven't been breaded, bake or broil only, and you go from there. A little bit of fruit, not a lot of fruit. A piece a day. Stay away from juices, because sugar is fructose, and fructose causes other problems in the body, even if it's good, healthy stuff.
Right.
So do that. Your grains, stay away from any of the gluten grains, and go to things like red and black rices, the heavy cut brown rices. Start with that, and when you come in, we'll do the rest of it.
Sounds great.
Thanks for calling.
Thank you so much.
I appreciate it.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.